So before entering the patient's room, I would check the physician's order and check the patient's chart for any significant data, including medication, dosage, and frequency. I would then identify and gather my equipment. I have a small volume nebulizer with 2.5 milligrams of albuterol in a 3 milliliter solution of normal saline. I have a corrugated tube, a T-tube, and a mouthpiece, oxygen tubing, and the normal saline. And for this procedure, I'm going to use an aerosol mask. I would then wash my hands for a minimum of 15 seconds and introduce myself to the patient. Hello, my name is Wayne. I'm from the respiratory department. Can you please tell me your first and last name and your date of birth? I would verify that information by checking the patient's wristband. I would then explain to the patient the procedure that I'm here to do. I'm going to give you a breathing treatment of albuterol, which is a bronchodilator, and the goal of albuterol is to open up your airways and hopefully make you breathe a little bit easier. I will then confirm with the patient that he understands what I had just explained to him. At this point, I will evaluate the patient's vital signs. I will count his pulse rate for a full minute, his respiratory rate for a full minute, and I will check his oxygen saturation using a pulse oximeter. I need to make sure that the vital signs are within normal values. The normal values for heart rate are between 60 and 100 beats per minute. For respiratory rate, it's between 12 and 20 breaths per minute. And for oxygen saturation, it's between 90 and 100%. I would also assess the patient's skin color, checking for signs of cyanosis and any levels of dyspnea. At this point, I would listen to the patient's breath sounds using my stethoscope. And then also on the back. I would then assemble my equipment. I would connect the oxygen tubing to the flow meter on the wall and set it to the proper flow rate, which is between 6 and 8 liters per minute. I would make sure that the device is working properly by checking for the presence of aerosol. I would then fit the mask on the patient, checking for fit and that the patient is comfortable. About halfway through first I would also coach the patient on how to breathe during the treatment, which is to just breathe normally with a few deeper breaths, and to hold in a few deep breaths, which will help the medicine deposit into the lower airways and will make the medicine work a little bit more efficiently. About halfway through the breathing treatment, I would reassess the patient's vital signs, again checking the pulse rate, the respiratory rate, and the oxygen saturation by using a pulse oximeter. I would monitor the patient for any adverse reactions, the main one being a 20% increase in heart rate. If a 20% increase in heart rate occurs, I would immediately stop the breathing treatment and notify a nurse or a doctor. Before stopping the treatment, I would shake or tap the nebulizer. Okay. The breathing treatment is now over. Take the mask off the patient before turning off the flow. I would again reassess the patient's vital signs, checking for pulse rate for a minute, the respiratory rate for a minute, and the oxygen saturation level. At this point, I would direct the patient to cough, and after coughing, I would reassess his breath sounds by listening to them using my stethoscope. Okay, at this point, I am done working with the patient. I would wash my hands for a minimum of 15 seconds. And after leaving the room, I would go into the patient's chart and document any significant data.